Okay, good morning, everyone. Thank you for joining the bi-monthly State of the Union. This is for managers and supervisors. I do want to thank you for joining the call again. There have been so many things that have been ongoing in the past few months. I really want to utilize this time to talk to you about a couple of important issues, and that would be not issues, but information that you have. I want to be sure that we have information on the whistleblower training program. I also want to talk about LGBTQ and how proud I was of what we have done, and to talk about some other issues in terms of compliance. But I do want to recognize and remind you um, that, if you're reading the news and if you're hearing Dr. Howard, if you happen to be on morning meeting, you're going to realize that, we do have another wave of COVID. COVID is still out there. We have about 15 staff that are out, and so they are unable to work. Half of those are clinical, and we're still trying to recruit people in. We have them in the pipeline, but they haven't come on board yet. So I want to remind you that to wear our mask while we're in the facility, and you can use the regular mask, or some of us have been trained for N95s. Wear eye protection with all patient encounters, and especially with the managers and supervisors, if you could remind people to do that. Remember, if you're ill, you need to stay home. Practice frequent hand washing is very important. Not only wearing the mask and social distancing, but hand washing. And please, if you see a veteran without a mask, please be sure that you hand them one and ask them to wear it. Um, Make sure you clean the infected area, high touch areas, and stay up to date on all of the COVID information. And I think our infection prevention nurses are very good in posting it, and what level we are in the organization for COVID. So right now in the community, it is high. Right now, the beds in the community are full, and we're at that level as well. So please be vigilant. I understand that you leave the facility, you do other things, but I still practice good behavior when I'm out. So uh, think about that when you're out in the community. So we have a few presentations today. Let's go to the next slide. So at the end of this session, after we do the accountability and whistleblower and the other presentations, I'm going to leave it all up to you and have you asking me questions or comments that you want to make and you want me to respond to it. This is your opportunity to talk with us. So let's go to Megan. Megan, are you on Castillo?
Dr. Broder, Megan was going to be doing the presentation.
She is. I apologize. I'm trying to make sure that she got called in. She did, but I think she's having some technical difficulties. I can go ahead and I'm trying to see if she got on. She had to call. There she is.
I had to figure out how to unmute myself, but I'm here.
That pesky mute button. Just as Miss Delancey was introducing Megan. Megan is the new SBU ERLR specialist. And so she's just going to do a quick overview on the Office of Accountability and Whistleblower Protection. So Megan, I'll hand it over to you.
All right. Good morning, everyone. My name is Megan Castillo, and I will be doing the presentation on the Office of Accountability and Whistleblower Protection. What is OAWP? The Office of Accountability and Whistleblower Protection promotes and improves accountability within the Department of Veterans Affairs. Next slide. The Office of Accountability and Whistleblower Protection is committed to improving accountability within the Department of Veterans Affairs. The office operates under the authority of VA Directive 0500. Next slide. The office receives and investigates allegations of misconduct and poor performance against VA senior leaders and allegations of whistleblower retaliation against VA supervisors. Next slide. The office receives whistleblower disclosure from VA employees and applicants, and if they do not involve whistleblower retaliation or senior leader misconduct or poor performance, it is referred for investigation within the VA, and the Office of Accountability and Whistleblower Protection monitors the investigation. The office is responsible for tracking and confirming VA implementation of recommendations from audits and investigations carried out by other VA offices. The office educates employees and stakeholders on whistleblower rights and protections. Next slide. There are 2 TMS courses regarding whistleblower rights and protections. One is for employees and one is for supervisors. Next slide. And you can contact the Office of Accountability and Whistleblower Protection through the phone number, through email, and they have a Twitter account. And that is it. And my
So
name,
Megan,
email,
Megan, this is Darlene Delancey. You just gave them overviews of OWAP. Are you going to do a little bit more in terms of whistleblower, what it is, you know, what supervisors should do if they get a complaint? Are you going to provide that for them?
We will be doing that on the power hours, Miss Delancey.
Well, I
So
had
we'll
asked for it to be done here during my supervisory training.
Oh, I apologize. And I
Well,
can
can you
speak to you
provide a
offline
little bit
about
more
that.
information? Thank you.
Sure. I'm going to go back a couple slides to what the office really investigates. And so when we talk about allegations of misconduct or poor performance against senior leaders, we're basically talking about when an individual feels, for example, that they have made a valid safety report, an EEO violation, prohibited personnel practices, anything along those lines, and yet they are being retaliated against by their supervisors and senior leaders at the facility. The most common examples that we see in HR is somebody has filed a hostile work environment complaint within their work unit, not necessarily against the supervisor, but within the unit. And therefore now the individual is being told that they are asked to do menial tasks. They are being unfairly rated on performance appraisals. They are being unjustly detailed to other positions. They're not being given fair consideration for opportunities within the VISN or within the unit at the facility. Those type of complaints are the ones that are often forwarded up to the Office of Whistleblower and Retaliation for protection under the agency. The agency will then go through the process of reviewing all the facts of the case, very similar to what we would do in ERLR and doing a fact-finding investigation. They would then take that process up through the next steps, but take it outside of the facility so that there is no further retaliatory actions if retaliatory actions were being done. And again, it's a big need to make sure that just because somebody files a complaint does not mean that it's always a valid complaint. They do weed out the invalid complaints, as they get kind of a good mixture of both valid and invalid complaints on individuals for whistleblower protection. We have had situations where individuals in the past had filed a whistleblower's retaliation complaint because they filed a safety report and supervisors were not really happy about it. So they really made that individual's life difficult within that unit. They then turned around and filed the complaint with the Office of Whistleblower and Protection and Accountability. That office took over. They pulled the investigation outside of the facility, found that there was cause, and as a result, addressed those issues with senior leaders. And I apologize, I'm not trying to give too many details because it's still in process of resolution, but that individual was reassigned not only outside of the work unit at the facility, but outside of the facility as a whole. They were actually given the opportunity to relocate to another facility. They chose one within the same VISN, but they were given the opportunity to relocate outside of the VISN to avoid any further retaliation or backlash, in shorter words. The office does track and confirm that all of the recommendations that are made by audits are carried out and that they are reported back to the Office of Inspector General. Excuse me. They ensure that if recommendations are made, that they're clearly communicated with the facility, and there are taskers that are out there for folks to complete by certain time frames and certain very bullet pointed functions that have to be done, actions that have to be taken, reports that have to be filed, or corrections that need to be made there within the workplace. They're going to follow those until completion and communicate that with all of the offices that you see here located in bullet number 2. Okay, as far as for the managers and what they can do and need to do, there are a lot of do's and don'ts that are what an individual would consider to be common sense, but we all know that sometimes you see things and you go, what? I don't understand how they decided to do that or what the conclusion is. As Megan touched on, there are 2 courses that are available in TMS. The numbers are listed here on this site. They are specific to employees and specific to supervisors. The Supervisor Whistleblower Protection Act goes through not only what to do if you have a complaint made against you, but also how to handle complaints that are just made within your section as a whole. The biggest thing is that with everything, if you have an employee that files a complaint, whether again it's a personnel complaint, it's a safety complaint, whatever, that we are not turning around and giving the perception, and that's the key word, is the perception of retaliation or backlash towards that employee. Now, perception is a big, very broad term, and we do understand that, and that's why we have the ERLR specialists. That's why we have the OIG office to help us with these particular things, because a lot of times people say, well, I just feel like they're not giving me a fair chance. And so all of those facts will be looked at and documented, evaluated, and then determined whether or not they're valid. If a supervisor does get a complaint of a whistleblower action, these are the contact numbers here specifically and directly to the Office of Accountability and Whistleblowers. Supervisors can always reach out and contact the ERLR staff, both at the SBU as well as the SSU, for assistance. Then that would be Miss Castillo herself directly. And then we also have Nicholas Vendetta and Amanda Barron, who are our SSU Shared Service Unit ERLR individuals. You can always reach out to myself directly, and I can help give you the basic information that you're looking for, and or make sure that you are getting the feedback and contact from the appropriate personnel who's going to be working with you throughout this case, and all of the documentation that's going to be needed. The websites here, I do notice that we did click on the hyperlinks on both the OAWP email address as well as their website. So I apologize, they're a little bit harder to read. I can drop all of the contact information in the chat for folks, but that will be something that, again, I highly encourage everybody to go on there and to look at, because all of the forms, the documents, there are frequently asked questions. Is there anything that the Office of Accountability doesn't handle? You'll find those in the frequently asked questions there, as well as, again, the email link to contact OWP directly, and then that 800 number listed there. Do we have any specific questions on OAWP?
Dr. Rutteridge, Sean, there's I'm monitoring the comments for Marianne. There's a question: what would make the difference between the EEO complaint and whistleblower complaint as to a personnel issue?
The big difference in that particular situation, and thank you, Marianne, for dropping the links into the chat, but the biggest difference in those complaints, there is the EEO complaint is really the initial complaint. The whistleblower is the retaliatory action that is potentially taking place against the individual that filed that EEO complaint. So again, an example that I can provide is a employee filed an EEO complaint against her immediate supervisor for various forms of discrimination. She then at that point perceived that the senior, the supervisor, so the service assistant chief and service chief, were then asking her to do duties and trying to discipline her for various situations that were not really applicable, and creating a further hostile environment. So she filed the complaint and escalated it to the Office of Whistleblower Protection, and they had addressed it at that point. And again, that is the one case where they did find there was retaliatory action based on that one particular EEO complaint, and they did reassign the individual to another facility. Any other questions?
Thank you, Christina. That really helped.
You're welcome. Nick. And again, we will be doing a little bit further and more training in the power hours, not on this Friday's power hour, but we will be doing this and repeating some of the information. So this is not the last time we're going to hear about it, or the last information that you will get, not necessarily because there's any problems, but we want to make sure that there is a reoccurring education piece for this.
Darlene, next up we have Trish Kidder. She's the care coordinator for the LGBTQ Veteran Care Program.
Good morning, everybody. Thanks for having me. I just have a few slides to go through. Really just looking to give you an update. It's been a little bit over a year since I was appointed to the Veteran Care Coordinator role, and with Pride Month just having passed it in June, I thought it was a good opportunity to just remind folks of what the Veteran Care Coordinator role is for the LGBTQ plus veterans that we care for here. So I have that here for you. It's all about looking at the organization in terms of how welcoming, kind of how we go about demonstrating how welcoming we are within our interactions, and also from the facility perspective. looking at the numbers of services and variety of services, see if there's any gaps or additional expansion of services. And then a lot of staff education, and then kind of individual and organizational advocacy in terms of the care that we provide. So next slide. So some of the core areas that I've been focusing on are community engagement, and I've done that by kind of latching myself onto the existing outreach committee that exists, and really special thank you to Suicide Prevention 2.0 folks, Jen and Michelle, and really trying to have some force multipliers here in terms of our community engagement and getting the information out there in terms of the services that we do provide, and encouraging enrollment when there's opportunities. We did that with the Albany Pride Center itself, and I think there's some opportunities now that we're past Pride Month to work more closely with them. Reached out to SUNY Albany Student Veterans Association. Again, really just trying to reach out to where the veterans are in the community, and to not only educate the community about VA, but also as hopefully a way to really touch them and kind of help pull them into our care. Also had an opportunity to connect with the Fenway Healthcare Institute. Big thank you to Pat Muster and education folks in general, but then also for helping to make this connection, and that we're hoping will bear fruit as we move forward in terms of our training and education here. Internally, I've again worked a lot with the education folks, nursing education, and developing a local training that was provided during Nurse Competency Fair, and ongoing. It's now a local item in TMS that's recorded that folks can watch. That's a introduction to providing affirming care. So just I've learned through the course of this past year how much of a team effort this role really requires. So I'm just so appreciative, and I'll try to recognize folks as I go through their help along the way. Just wanted to highlight our local services here. Again, our general services that we provide that are available for every veteran. But specifically, we have a Pride support group that occurs weekly, that's been occurring virtually. A lot of great connection with the Women's Health Clinic, and specifically around our trans women population, and creating a welcoming environment in those areas. I was invited to participate in EOC rounds. So again, as I learned the role and have found my way through it, that's been an eye-opener, and looking at our facility from that perspective in terms of accessibility and kind of signage and things like that. And next slide. So staff education, as I said, is a big piece of what I have been doing and will need to continue to do. One of the main things I focused on is awareness, and thanks to the GPM staff and MSA staff and supervisors around getting the word out to veterans that we can now update their medical record to reflect their preferred names, their preferred pronouns, their self-identified gender identity. Within our demographics capability now, we can update all those pieces. And soon, I believe sexual orientation will also be included. So this is an important kind of campaign, for lack of a better term. This education is important, and these allowing these opportunities for veterans to share this with us, because our sexual orientation, gender identity, how we identify across multiple domains, is important to our healthcare, and our sexual health is just as important as our cardiac health and otherwise. So these are just, you know, incremental ways of where we can get that message out that we want to know this about you, because it's going to better inform your care plans. It's going to, again, create more welcoming exchanges amongst staff. As we prepare for the removal of the exclusion for gender affirming surgery, this past year, we've had a local work group that I've reported up through our organizational health committee. And we've been kind of doing a gap analysis of the directive related to transgender veterans. And thankful to all the folks that participate in that. Dr. Mansouri, who's you know, really taking a look at all the opportunities that are available for our surgeons in terms of training. There was one more recently where there's a training at Walter Reed regarding feminizing facial surgery. And there's, with our academic affiliate, there's a surgeon who has expertise there. So just really appreciate that and share that as an example, as a keeping an eye on the future and the way things are going, and kind of how Albany can be readied for that, and what opportunities we have to grow in that direction. I created a local Teams channel that, as I went out to various staff meetings, I provided that. So just another way to reach out to me if there's questions or concerns, and there's also resources there for folks to share. In general, there's tons of TMS education and training for CEU credit, as well as the Health Equity Index credit. That's a survey that we complete, and we're awarded top performer status last go around. So which is great for us. So I'm appreciative of that. And go to the next slide.
Trish, I just want to let you know I've been dropping in the links to all of the trainings and the
Oh, perfect.
Yeah, dropping them in the chat box for anybody that wants to click on.
I appreciate that. National updates, they're, you know, just, I won't read them to you here, but just your awareness of what's available to providers. There's a national e-consult if there's questions around hormonal therapy, around mental health care related to this population. There's tons of fact sheets, healthcare related fact sheets for those who identify. And you know, the biggest thing is, again, as we move forward to preparing, going through the rulemaking process for gender affirming surgery, there's, you know, clearly a lot to be done and to be found out in terms of what that system of healthcare is going to look like. But it's obviously something I'll be highly tuned into and sharing with you all. Next slide. Again, just more resources here around the different directives and training opportunities. There is a healthcare equity, a VA ECHO. Those are great trainings just in general around a healthcare equity around all vulnerable populations. So I would encourage that. It's not just related to LGBTQ plus veterans. And then next slide, maybe. Yep, so this is from our Pride Parade we participated in. Just it being my first year of organizing, it takes a medical center really to do it and to do it well. So I'm just grateful for everyone who helped, everyone that participated. It was nice that Pride Month and AES aligned. So I was able to kind of do some pop-ups that were AES related and to highlight Pride Month. So again, just can't say how much I'm appreciative of that. And I think that may be it for me. Other than to say that we do have, you know, on our internet page, there is a local LGBTQ plus care page I provide there as a link. And it really, I really have been getting emails and phone calls from veterans reaching out, asking questions. I've helped get a few enrolled, so I'm feeling very, very good about that. So, any questions?
You should feel very good about everything that you're doing, Trish.
Thank you.
Trish took on the program for our veterans, the clinical aspect of LGBTQ. We do have a committee for staff so that we can involve our staff and have Trish focusing in on our veteran population and the support. So we thank you. Pride Parade is unbelievable. It takes a lot of effort, a lot of people involved, and what's very moving are the veterans that come and are thankful for the support. So as a manager and supervisor, these two areas are very important to us for you to understand. And I know a lot of times we're talking about performance plans and measures and everything, but I do want you to understand what you're being exposed to as a manager and supervisor on a day-to-day level. On a day-to-day effort, you're being asked numerous questions. So these are two of the programs that our focus has been this past quarter. So thank you, Trish.
Thank you so much.
We do have a new diversity committee and it's just starting out. So if any of the managers or supervisor would like to be a part of that diversity committee, that would be wonderful. Right now we have Linda Rodriguez who's on, and I can see that she is on the compliance officer. She's going to talk about the code of integrity. And I know that I don't have to ask or tell managers to do that, but it's very important that we look at the purpose and that what happens when people raise concern and what our role can be. So Linda, why don't you take it over from here?
Okay, will do. Hi, everyone. I'm here to talk about the Code of Integrity. It is it's a consolidated document that simplifies and connects the key laws, regulations, policies that apply to the VHA. It's a guidance document basically on how people should conduct themselves, treat others, how to perform their work with integrity. This document is specific to VHA employees, so it serves as a single document and a reference document. It's really a great document for reporting concerns, whatnot. The purpose of it was we didn't have a consolidated document for VHA. The code echoes sort of the 7 pillars or 7 values identified for becoming an HRO, like continuous learning, acknowledging our duty to speak up if we see something wrong, creating an environment in which we're all respected and valued, and fostering just culture. So it tells you how to report, where to report. It's centered around the I-CARE values of integrity, commitment, advocacy, respect, and excellence, and provides this high-level sort of guidance regarding VHA's expectations for how we work together, provide care to veterans, conduct research, maintain financial records, protect assets, and serve as government employees, all of which are pillars of the VHA. So it's not a new policy. It just simply brings together the patchwork of all the existing documents into one high-level umbrella document. It streamlines the rules and standards regarding integrity across VHA. It gives us sort of consolidated specific points of contact to raise questions and concerns, and helps us know when to raise these concerns and how to report violations. For instance, there's contact information for VACO, the Office of General Counsel, which is for matters related to concerns or allegations about prohibited personnel practices, including reprisal for whistleblowing, employment discrimination, improper hiring practices, etc. So you have that. You have OIG hotline for criminal matters, the Office of Dispute Resolution, which includes, EEO, matters or other sorts of issues related to that. It gives you privacy contact numbers, business operation contact numbers, patient safety, information security, research noncompliance, healthcare ethics. This document is really different. It does cover ethics, but it's different than the 14 guidelines for ethical behavior. That's just a broad federal document. This specifically refers to VHA. It's got contact information for occupational health and safety. So it's really just this document that contains a lot of information about who to contact, how to contact, and when you should contact someone. Of course, we always encourage you to go to your supervisor, but I give this document to everyone who comes through new employee orientation and tell them, we prefer the chain of command so that we can address it right away. But if you don't feel comfortable doing that for whatever reasons, this document is available and you can always contact any number to report anything that you want. We don't discourage that. We want people to bring forward issues. Everyone gets this document, so I thought it was a good idea to give it to supervisors and managers and remind them that it's there and it's available, and they should let their employees know it's available. Compliance is concerned with, reporting violations. That's one of the things we encourage people to do. We can't fix it if we don't know it's broken. So we always strive to get people to come forward and to know that it's a safe environment to do so. I remind people, if you see something, say something. You have a duty to report violations. And that there are a number of avenues. Compliance tends to focus on risk, fraud, waste, and abuse. And I have a little film. I don't know if you can click on that link there. It goes over fraud, waste, and abuse real quick.
I'm opening it up, Linda. Just give me a moment.
Okay, no problem. We always want people to be diligent and stay aware of things that, that if it makes you feel uncomfortable, it doesn't seem right, please contact us and let us know. I tested it yesterday, so hopefully it's working. Sometimes
Sorry,
takes
Linda, technical difficulties. I'm getting there.
All right, no problem. I also have, oh, it looks like it might be starting. There we go. Just need the volume. Yeah, there's no audio.
Sorry. Hold on. Can you see the screen?
Yep.
And Marianne, you have to stop sharing your screen, and when you reshare it, click the little box that says include audio. Then you'll be able to hear it.
Is behaving improperly or unreasonably or misusing one's position or authority. For example, rely on VA employees to report suspected fraud, waste, and abuse. But it's first important to understand the difference between each. Fraud is attempting to gain something of value by intentionally misrepresenting a situation. In other words, fraud is a form of intentional misconduct. For example, when VHA is intentionally overbilled for medical services or supplies, this is fraud. Waste is misusing money or resources, even if not explicitly illegal. In other words, waste is typically careless but not intentional misconduct. For example, when through lack of coordination across VHA facilities, VHA orders more medical supplies than it can use, this is waste. Abuse is behaving improperly or unreasonably or misusing one's position or authority. For example, when medical services or supplies are improperly prescribed or used, this is abuse. Who should report violations of fraud, waste, and abuse? All VA employees with knowledge or information about actual or possible fraud or violations of criminal law related to VA programs, operations, facilities, contracts, or information technology systems have an obligation to speak up when fraud, waste, and abuse is suspected. All VA employees should report any fraud or criminal activity to VA OIG by calling 1-800-488-8244 or visiting www.va.gov/OIG/hotline. Compliance or integrity issues can be reported to your supervisor, any management official like your VISN or medical center director, or to VHA's Compliance and Integrity Program. Please refer to the VHA Code of Integrity for a list of appropriate contacts by issue area. The Compliance Helpline is another resource for reporting or asking questions about compliance and integrity concerns. The helpline provides the option of reporting anonymously. VHA prohibits retaliation against those who report non-compliance or integrity concerns in good faith. It is everyone's responsibility to do the right thing and comply with the laws, regulations, and policies that apply to their work. To learn more about your role in preventing fraud, waste, and abuse, visit the VHA Compliance and Integrity Program intranet page.
Okay, everyone, just a quick little film to show everyone what fraud, waste, and abuse is. I have a number of posters related to compliance, like for instance, the Hatch Act or reporting, the duty to report, compliance hotline numbers, the OIG numbers, all of that. I have posters on just a number of different issues. So I send them out periodically, but if anybody needs any of them again to post in their areas, please let me know and I'll send them to you. And if you haven't gotten the code of document or code of integrity, let me know and I can send that to you as well. That's it. Any questions, comments?
Linda, just want to extend an appreciation providing that to our supervisors. You know, as you know, supervisors have a lot on their plate. You know, they're pulled, they're the middles. So they have to understand and recognize the programs that are available for them as employees, but also be able to share this information to others. There's a hand up. I'm not sure who that is.
Yep, good morning, it's Amy. I just wanted to ask, and maybe it was addressed, Linda, if this replaced the code of conduct or if we still have both.
We still have both. This is specific to VHA only. It's just, it encompasses all of VHA. So as to where the other applies to, you know, just federal employees in general.
Okay, thank you.
Sure.
Thank you. Thank you, Linda. So what I want to do at this time is I want to go over a couple of things in terms of what's going on in projects to keep you updated as a supervisor, and then open it up for questions, any type of question that you might have. So project updates, do want to let you know that the MRI construction is ongoing. As many of you know, you see the trailer that is outside over by the ER entrance, and we did that waiting for the new MRI to come on board. Really want to express an appreciation to the workers within radiology who made that happen, to the leaders and the supervisors to ensure that our patients are being taken care of. So Oneonta, CBOC, at this time, you know, it's still under construction. Bainbridge will be transitioning to Oneonta. Probably I would see that hopefully late September, early October. But we will have some services that will still be available as we slowly transition completely to Oneonta. The cath lab on the 8th floor, we're doing weekly, we're looking at, let me go back before I talk about the cath lab on the 8th floor. The cath lab, we're working on the project at this time to reopen our cath lab. So we're looking for staffing of it, the final approval from the network and central office. A very near future, but I do want you to know that it has a lot of effort of a lot of people who have been working on that project to get that going. The cath lab on the 2nd floor project is 60%, and that would be the new lab, design and review. So again, we're going to be focusing on, again, it's only in design. So we're not completely done with the design part of it. We will look at employee parking, and the projects team is working on how we will phase that in. We will not have the garage, but we will have to do over the parking lot. And I know many of you come in and are hitting the bumps and there are divots in that, but that's coming probably the spring of 23 construction. SPS, a long time coming. Hopefully everything will be completed and we can have an opening again around August, September. Still a lot of little things that we have to ensure are ongoing. I don't even want to talk about this, but we're still focusing on getting a new ED. I think I came here 4 years ago and that was just on the table, and we're at a point right now we're soliciting for proposals, and bids are due in for August 2022. So I'm hoping that we can initiate that new ED. But again, you know, a lot of these projects take time and effort, but they're still on our books. CLC, contracting is in the process of doing some final touches that came up at the end. The project team has been working very hard. The CLC on the 4th floor will be the 2 wings, so it would be 24 beds. And it's absolutely beautiful space. And we hope that we'll be able to be in that space, but a lot of not just the construction piece, we're focusing on staffing. Again, staffing is a large issue, as many of you know. So if you or someone that you know are thinking about coming in, have a need to come into the VA, talk to them. Perhaps it is the area that they want to work with, especially in nursing, with our nurse recruiter. We can do direct hires, but we want to keep our facility, especially the CLC, bringing on new NAs and LPNs. That would be fabulous. So if you know someone who's really looking at some wonderful places to work, Albany has one of the highest best place to work scores ever. Dialysis, wow, I took a walk through the new dialysis, that's scheduled to be open. What a change. When you go into the old dialysis area, it's like being in one room. This is spread out. There'll be places that if someone comes in with a veteran that is getting dialysis, they can sit with them. It's very bright. It's very lovely. I think the team is going to be very excited about being in the new dialysis suite. I would think by the end of July, maybe August. Probably, I don't want to make any promises, but that's looking very promising in the next few weeks. I think they're waiting for the telemetry award, so that still would need to be activated. All right, now, so that's our projects that we have on the list of what's coming and going. in the organization. So now I'm going to open it up. If anyone has any questions, you can ask anything, not just what has been mentioned today about whistleblower, LGBTQ, or the Code of Integrity, or any of the projects, anything you might have. Amy, are you referring to the Code of Conduct policy that we have in Albany?
Yeah, I was just thinking, in addition to the Code of Integrity, it would be helpful to also send out the Code of Conduct policy if HR could help with that.
I reached out to Dr. Rudder, Amy. She's going to drop it in the chat box when she gets in the
Great, thank you.
Great. Any questions from anyone? Any rumors that you'd like to dispel? Are there any suggestions that you would like? Would you like some type of formal agenda items for this type of meeting? I know that we're doing a lot of training on supervisors and managers. I just talked to Darcy yesterday. HR is offering some great training. I would take advantage of that.
There are some questions in the chat box.
Thank you. Any chance, what does it say? Any chance of getting HR in the building? Well, I think that the teams are virtual across the visit. So there are some individuals within HR that are here. Christine, can you answer that? Which groups are here physically? Christine Rudder, are you on?
Hello?
Yeah, Christina Rudder, are you on?
This is Megan Castillo.
Hi, Megan.
Hi. So I'm relatively new to the VISN, but I know there are assistants that are actually at the facility, but there are also specialists that are remote. But there are some staff
Okay,
there.
so the PIV individuals that are doing the PIVs here, but now I can answer that question that it's not going to be the way it was. Right now, all of HR is mostly virtual. So you have to, what Christina can do is to ensure that all managers and supervisor have a list of individuals that they would contact based upon which team they need to be working on. If they need to be working with recruitment, if they need to be working with work balance and benefits team. So she will provide that those POCs to you, but not everyone is going to be here for you to contact. We no longer practice in that modality, and it's the way HR is set up. It's a virtual organization.
Hi, Darlene. This is Kelly Baldwin. I just wanted to continue with that question just for further clarification. Coming from my nursing supervisor position now to a nurse manager position, I have a chance to meet with all the staff in the building. And without doubt, the biggest complaint from staff is that there's nobody available to to answer their HR questions. So I understand we have virtual people, but if I feel like there's a struggle with getting answers, and now as a nurse manager, I feel like there's a bigger challenge getting people in the door. I think it may be a little bit easier if somebody was in the building. So there's no chance that that's going to happen, is my question. Or how do we make it a better, more flawless, seamless system to get people and new hires in the door? Sorry, that was my question.
So I think those are great questions, and it is not questions that we have not heard about. I know that we just have a new strategic business partner that came on board. Many of you have met her on the phone or on morning meetings. She will be coming in August. She is a virtual employee who happens to work out of a different state, but she works with us as a strategic business partner. She will ensure that you have all the points of contacts. We recognize that this has to be a struggle, but as we go through the changes, I believe that we'll be able to move forward. There will be her team, some of her teammates, I'm not sure which ones will be present in Albany. She'll have to answer that question. I'm not sure if she's on. We have just recently had people move on to different positions within HR. So I'm not sure which team members will be present here in Albany. Christina, can you address that?
She actually had to jump off to go to a mandatory training, but I will let her know.
So what I would like to make sure that we put in is a POCs for each unit and who they would contact as a supervisor.
Got it.
Got it. Good.
I'll let her know.
Okay, wonderful. Thank you. Okay, Glenn is asking, is there an opening date yet for, the employee gym? I believe that what they're doing is preparing for the educational piece that has to go along with it. And I know that they have to put in the swipe cards for swiping in and swiping out. That's what I've been told, but I haven't been given a date. If Chino, you're on, do you know of a date? Okay, I'm batting 1,000 today.
Darlene, it's Marlene. Just a little bit on the gym. The IPID staff talked yesterday with occupational health. So they were looking at a number of staff that could be in there at the same time based on the level of COVID in the community. So Alc Health had a few questions to reach out to National, but hopefully within the next few weeks, if the swipe card's in and with ID approval, we can start to open that.
Okay, that sounds wonderful. And the gym is absolutely beautiful. It's better than any gym that I've seen out in the community. Edna May, I think you made a wonderful suggestion there. I do think that HR is talking in HR lingo, and they have to put it into the lingo that we understand. You are correct. All right, yes, and Keith, you're correct. HR used to provide a who's who. Maybe they can do this. We'll ask for that update. I think what's happened, Keith, recently, there have been a movement of people that have left and new teams have been put together. So that may have been why. All right, and the code of conduct is a policy. And we know it's not part of the code of integrity, Linda, but it is a code of conduct that we have as a policy for our organization.
Darlene, there's a question from Lisa Hewson. Is the hospital tube system going to be part of the ER project?
I don't know. So I don't even know what the hospital tube, I've not heard of that. Is that a tube which sends information or documents? What is the tube system?
It's for-
It sends specimens to the lab.
That's
So
my
like instead of them
Okay.
like having nursing bring specimens down from the floor, they would just pop it in the tube and it would come to the lab directly.
Okay. Yeah. I do not know. But who asked the question?
I did, Lisa.
Okay, Lisa, we'll get back to you. I don't know.
It was part of the last ER project.
Okay, well then I wouldn't imagine they would take it out, but
Okay.
things do happen. I'll have the associate director get back to you.
Okay, thank you.
Hi, this is Debbie from the ER. The pneumatic tube system is still included in the project at this time.
Thank you, Debbie.
You're welcome.
Kind of like the Christmas Story movie where they send in the paper, right? Got it. All right, HR has said HR Power Hour this Friday will present information from CCOE and work-life benefits on processes and contacts for each group. We will also start implementing lunch and learn sessions, which are much shorter than 1 hour sessions that will help bridge some of the educational gaps in the various processes relating to HR. And I think, Christina, what people are asking is they would like to know, maybe there's a chat line that we can put in that people can chat with you and ask questions and someone can get back. That's really what it's the just-in-time questions answered that is sometimes needed by a supervisor.
Darlene, I know we need to wrap it up. There was a comment from Dan Jasevich. She wanted to thank you for the project updates. There's always a lot of questions from the staff about the projects. So that was appreciated. Thanks, Dan.
Okay. Is there any other questions that you might have? We're moving quickly. As supervisors and managers, you're in the middle. I get that. You're being pulled. I'm asking for things to be done. Your employees are asking for things to be done. We've got a lot of moving parts. COVID is with us. We have 5 more COVID patients in house today. We're still working through that. Our infection prevention nurses and physicians are working very hard. Everyone is. You're amazing. You are the heroes, and yet you take care of our veterans every day. I'm humbled, as I have always said, to be a part of this team. I'm honored to be able to work beside each of you on a daily basis. I know that you don't always get a pat on the back, but I want you to know that we truly appreciate it. We try to do as much as we can. We're looking forward to the all-employee picnic. I hope supervisors and managers will be on board for helping us out during the employee picnic. I know it's really very exciting for employees to do. Are there any other questions or comments? I ask that you enjoy your summers. Please make sure you take time for yourself. Get to the gym here and go outside during lunch, take a walk, take a break. It's very important for you to stay healthy and well. So I'm always available. Any one of our executive team are. We're here to serve you, and we appreciate you serving our veterans. Thank you, Mary Ann Jones, for this. Okay, thank you to our speakers. Appreciate it. I'll let you sign off now.